Hello friends, welcome to my channel. I am Dr. Sachin Jain from Jaipur, and today we have a special patient who has come from Telangana. His name is Durga Prasad, and he is a volleyball player. He has played state also and is a very good volleyball player. So he doesn't know Hindi, so we are going to converse in English. He doesn't know to speak English also much, so his interpreter is going to talk what all things has happened with him, and we'll discuss about his case. His case is a little special. What had happened to his knee? When was he had a fall while playing volleyball?
Yes, sir.
And your knee got twisted.
Yes.
And what? When was that?
January 31st.
2026. So 3 months back, he had an injury in his ACL. So he got operated for his ACL at his native place.
Yes.
And after that, his ACL got infected. So there, the primary surgeon did a washout, cleaning everything, gave him antibiotics, but there was no relief. But he didn't remove his implants. Implants were inside only, and there was a constant fever, and his pulse was not coming, stopping, and his knee got locked. So there was only 20 degrees of range of motion.
Yes.
So after 20-degree range of motion was not possible. So he has come all the way from Telangana almost 5-7 days back. So when he came to me, he had a very big small means the wound was infected, pus was coming, and there was knee range of motion 20 degree. So we went to the operation theater the same day. We cleaned all his knee with 9 to 10 liters of saline, gave a thorough washout. His tissues were very badly infected. The screw I didn't have to remove with a screwdriver. I just picked an artery forceps and just pulled, the whole screw came out. The whole button was out, and the threads which were there were all infected. All the tissues of ACL was so badly infected, there was nothing to hold it. So we had to clean all the ACL which was there. We removed all the bad tissue, we cleaned up all the tissues, and we put a drain inside his knee, and we sent the tissue for culture. So after sending the tissue for culture, we gave him antibiotics. The culture report came after 3 days. The culture report was surprisingly resistant to almost all the antibiotics. There were only 3 antibiotics out of 30 antibiotics which were sensitive, and that also antibiotics were very difficult to find. So we found that antibiotic and we gave him. Now 5 to 7 days the antibiotic has been given, and now his recovery stage is going on. Dressing has been done. He also had a big wound in his foot because of the ACL infection. The whole leg got infected, and there was a big wound in his heel which also got infected, and there was a whole tissue which was out. So that also we cleaned, and now we have put a skin graft in his foot. So overall, now that one more thing, the arthroscopy, we also released all his tissues and we bent his knee. So there was a full bending achieved during the operation theater. We don't have the videos, unfortunately, because that time I was busy in his operation, so I didn't get time for recording. So we bent his knee completely. And now, after 5 to 7 days of operation, how much is your knee bending? How much is his knee bending?
110.
130.
110.
110 to 120 degrees
Yes.
knee is bending from 20 degree which was starting.
Yeah.
So now 120 degrees is bending, but if you go more, it goes more.
Yes.
It doesn't stop there,
Yeah.
right? How is his wound? Wound is how much? Did you see dressing when he was doing?
Yeah.
Was any pus or any bad tissue coming? Now
No.
everything
is clear.
Everything is clean.
Clean.
All blood is only there. Nothing is there.
Yeah.
The down tissue graft also is very nice.
Very good.
Very good. So overall, this video I am recording. What you want to tell the patients who have been experiencing this kind of infection in their body or in their ACL is, if they get infected, what should they do?
Yeah. Actually, since last 3 months, he's suffering with the pain and pus. Actually, 6 months back, one of his brother came here and treated by Dr. Sachin sir, and now he's walking and running, and he's treated well, and he's completely healed. So because of him, we came here, and within 1 week, the result was awesome, and he's able to bend his knee, and the wound was also clean and clear. So I suggest everyone who is facing the same issue, come here and Dr. Sach will take care of you.
Yeah, that is one thing which we can tell, that you come here. But what I want is that I want to understand the people who are suffering with this problem, who are suffering with infection. So they shouldn't be, discouraged, that then once your infection is done, then their life is over.
Yeah.
Now my knee is gone. Now my life is over. I cannot do anything. My life will be over. Is that the thing? No,
No.
right? So once we do nice cleaning, we give antibiotics, we give nicely all the proper treatment, the infection will stop. And once the infection stops, you have a re-chance to do your ACL again and that get proper treatment. And you can again go back to your life and sporting activity.
Yeah.
Also. That is also a possibility.
Yes.
So you should never lose hope. That is one thing which is there. First thing. Second thing, timely treatment of this problem is very important. The timely means you cannot postpone this problem. Once you have got that there is an infection in your knee, you should not delay for even one day. Because the day when you came to me, I said the day when you have come, I will operate at that day. Because I don't want to delay one more day for you. Because the earlier you get all the cleaning done, the earlier the result will be there.
Yes.
The same thing, if that place what has happened, I don't know, but the same type of cleaning, the same type of washout and everything, if would have been done, then things would have been not right. But infection is such that you cannot control. Some patient can get better, but if the infection is still not improving, is still increasing, and if you still keep the implants inside, then you are going to have a very bad knee and a very bad life, both things.
Yeah.
So the decision making that the implants has to be out has to be taken then and there. When that has been done, now everything is washed out. Hopefully now the infection will not come back, because you have to take IV antibiotics also for 2 to 3 weeks. Then oral also 6 weeks.
Yes.
And after 2 months you have to come back again and show me your knee and see how best is your bending, how is your infection, how much is your CRP and ESR. Now once you go back there, the ESR CRP which we have done, because the quality of the lab is also very important.
Yes.
Because the lab quality which is been done here is very good quality, so the ASR CRP report is going to come very nice. But again, if you go back there, the lab quality we don't know, so the ESR CRP can give a false image. And if you get a false image, then you will be again confused that my infection is not coming down. But point is that the infection is coming down, that there is no pus, first thing.
Yeah.
Second, the knee is not so warm as it was before. Okay.
Yes.
You don't have any fever. Yes. And your food appetite is also increasing.
Yes.
Means now you feel that I want to eat food, because if you have infection, you will not feel to have food. Understand?
Yes.
But antibiotics are also heavy, that also will make you feel less eating food. But antibiotics are very important at this point of time to recover your knee. You understand?
Yes, sir.
So I hope our treatment was enough for you, and may you do well in your life. And after 2 months, we'll come back. Anything you want to tell Durga Prasad from your words? If you want to tell in Telangana also, you can tell. Telugu.
Telugu.
Yeah, Telugu. Those people who are understand,
So-
you will interpret afterwards.
So my brother also ACL problem. So come to the Sachin sir. సో నేను కూడా ఈ ప్రాబ్లం బట్టి ఇక్కడికి రావడం జరిగింది. సో ఇక్కడికి వచ్చిన తర్వాత నాకు 3 డేస్లోనే రికవరీ అనేది ఫాస్ట్గా జరగడం జరిగింది. అండ్ కిందన ప్లాస్టిక్ సర్జరీ కూడా చాలా బాగా చేశారు. అండ్ త్వరగా రికవరీ కూడా మనకు కనిపిస్తుందని చూస్తున్నాం.
So I think everyone understood that. So take care of yourself, Durga, and all the best for your recovery.
Thank you, sir.
If anything is there, you message me. Okay.
Okay, sir.
Take care. Thank you.